Are there specific screening guidelines for men at risk of HPV? Have you ever wondered about the screening guidelines for men at risk of human papillomavirus, commonly known as HPV? This is an important topic, as HPV is a widespread sexually transmitted infection affecting both men and women. It is linked to several types of cancers, including cervical cancer in women and certain cancers in men. However, the approach to screening is quite different for men compared to women. Currently, there are no established routine HPV screening tests specifically for men. While women have well-defined guidelines for cervical screening, such as Pap smears and HPV tests, men do not have standardized protocols to detect HPV infection or related cancers. This absence of routine screening is partly due to the fact that HPV-related cancers in men, like penile, anal, and oropharyngeal cancers, are less common. Furthermore, the screening methods for these cancers have not been validated for widespread use in men. However, some men are at a higher risk for HPV-related cancers. This includes individuals who are immunocompromised, such as those living with HIV, men who have sex with men, and those with a history of certain HPV-related diseases. For these high-risk groups, some clinical guidelines suggest targeted screening. For instance, anal Pap tests may be recommended for men who have sex with men or for HIV-positive men to help detect precancerous lesions early. Given the lack of routine screening, it is crucial to focus on preventive measures. The HPV vaccine is highly recommended for boys and young men to help reduce their risk of HPV infection and the potential for developing related cancers later in life. Expanding vaccination efforts to include males is increasingly recognized as a key strategy to prevent HPV transmission and reduce the incidence of HPV-related cancers in both men and women. In summary, there are currently no general population screening guidelines for HPV in men. However, targeted screening may be advised for high-risk individuals. The HPV vaccination remains the primary preventive measure for men, significantly lowering their risk of HPV infection and associated cancers. It is essential for men concerned about their HPV risk to consult healthcare providers for personalized advice and potential screening based on their individual risk factors.